We are here today to announce the presence of the first case of coronavirus disease confirmed in Nigeria. We are taking this step in order to give the clear facts to the public, which we hope you will all report accurately and be one step ahead of rumors and speculations and fabrications that tend to occupy the space, particularly the social media space at this time. And the case is that the Federal Ministry of Health has confirmed a coronavirus disease case in Lagos, Nigeria, known as COVID-19. The case was confirmed on the 27th of February 2020 and is the first to be in Nigeria since the beginning of the outbreak in China in January 2020. It is an Italian citizen who works in Nigeria and returned from Milan, Italy to Lagos, Nigeria on the 25th of February 2020. He actually landed here in the evening of the 24th, but by the time he got into his residence, Lagos, already 25th. He was confirmed by the virology laboratory of the Lagos University Teaching Hospital, which is a part of the laboratory network of the Nigeria Center for Disease Control. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos. The government of Nigeria, through the Federal Ministry of Health, has been strengthening measures to ensure an outbreak in Nigeria is controlled and contained quickly. The multi-sectoral coronavirus preparedness group, led by the Nigeria Center for Disease Control, has immediately activated its National Emergency Operations Center and will work closely with Lagos State Health Authorities, or let us say is already working closely with Lagos State Health Authorities to respond to this case and implement firm control measures. I wish to assure all Nigerians that we have been beefing up our preparedness and capabilities since the first confirmation of cases in China, and we will use all measures and resources made available by the government to respond to this case. We have started working to identify all the contacts of the patient since he entered Nigeria, and even those who were with him on the aircraft. We have been in touch with the aircraft authority, the aircraft owners, to find out who his seatmates were. Please be reminded that most people who become infected may experience only mild illness and recover easily, but it can be more severe in other people, particularly those who are elderly and those who have other underlying chronic diseases. All Nigerians should therefore take care of their own health and maintain hand and respiratory hygiene to protect themselves, protect their families and others, following the precautions which I give you below. First, regularly and thoroughly wash your hands with soap and water and use alcohol-based hand sanitizer. Secondly, maintain at least 1.5 meters, about 5 feet distance between yourself and anyone who is coughing or sneezing. Persons with persistent cough or sneezing should stay at home and keep away from crowd, should not mix around in crowd, and should keep what we call a social distance. Make sure you and people around you follow good respiratory hygiene, meaning that you cover your mouth and nose with a handkerchief or tissue, or if you have none of these, sneeze or cough into the sleeve at the bent elbow, or use a tissue when you cough and sneeze, and dispose of these immediately. Stay home if you feel unwell with symptoms like fever, cough, and difficulty in breathing, and catarrh, and call NCDC, which is available day and night. That is Nigeria Center for Disease Control. And the number is 0809 and 70000010. It has been given before. Please do not engage in prolonged self-medication. Stay informed on the latest development about COVID-19 through official channels on TV and radio, including Lagos State Ministry of Health, NCDC, and Federal Ministry of Health. Citizens must not abuse social media and indulge in spreading misinformation and false rumors that cause fear and panic. The Federal Ministry of Health, through the Nigerian Center for Disease Control, will continue to provide updates and will initiate all measures required to prevent the spread of any outbreak in Nigeria. Thank you very much. That is the brief. We are going to welcome questions.
Honorable Minister, in word and you are live on the NGA.
I see. Okay.
Thank you very much, Honorable Minister, for that briefing. I know. We have so many hands up for questions here. And it is very good because a lot of gray areas will be corrected. I had a text message from one of my colleagues. I'm not going to, don't worry, I'm not going to mention your name. Asking me to clear.
We'll stop it at
because he heard the patient
that we are live on
is
TV, so
the Federal Ministry of Health staff. It is now clear the patient is not the Federal Ministry of Health staff. Thank you. So questions?
Good morning, ladies and gentlemen. My name is Rabi Abdullah, and I head the health desk at the NTA. It's a sad Friday for me, if you ask, but of course it's a global village. The world is a global village, so notwithstanding, I want to just ask as a rider to the information your staff just passed. We're interested in knowing the identity of this index case in the country, one, and what happened. Was it that we missed the screening at the entry point? That's talking about airport now. Secondly, did he just walk to a health facility to present himself, or he was found? Because if we need clarification on what really happened, so that it shouldn't turn out to be a case of where we have people who are actually moving around the country with the virus without presenting symptoms for now. Thank you so much.
We'll take the questions in batches, take 3 and 4, and then answer.
Good morning, Honorable Minister. My name is Uwais Abubakar Idris. I report for Deutsche Welle. I want to find out what is Nigeria doing to trust the people that might have traveled together with this person. And secondly, the issue of quarantine has been raised several times. I was made to understand the Minister of Justice said it's against Nigerian law to stop somebody that came back from traveling and put him in a hotel for so long. Now that it has happened, many countries have been doing it and they have this law because the health of Nigerians is more important than any law. So I need clarification on this. Are you now ready to go and start quarantining travelers from the affected regions? Thank you.
I work with these days. So yesterday at the floor of the National Assembly, the senators raised concern about the level of preparedness that the country has shown, particularly at the entry point, in terms of screening of passengers. Is the ministry now going to change the way things are being done at the airport? What proactive action are you intend to put into place?
One more for the third question. Okay, no, we don't go inside.
Good morning, Honorable Minister of Health. I'm Joseph Kadri, report for ITV. First, I want to know if the Commissioner for Health in Lagos State has the express permission of the Federal Ministry of Health to declare an outbreak. Second, we have the issue of prevention now, which is the use of face masks, medical gloves. Do we have enough, in circulation that, of course, many persons will be able to use and ensure that this virus is not spread? Thank you.
Okay. Now, those are the first four batch, first in batch. First of all, respond to the NTA who wanted to know what the screening is. We have been preparing very hard for this situation and working very closely with the World Health Organization. World Health Organization, as we all know, is the world body concerned with looking after global health, checking out public health security and situations like this, and they give advisory to all countries. The World Health Organization warned just the day before, I saw on the news, that all countries should brace themselves for a possible entry of spread of coronavirus into their own states. And since then, we have continued beefing up our own security. The second thing that he said is that the coronavirus symptoms may not manifest within the first several days. So a person who gets infected may not show any signs at all within the first few days, like 3 or 4 or 5 days. And then the symptoms begin. So if that person has traveled within that window, they can get through anywhere and not be noticed. So the gentleman who came here apparently may have gotten infected at a point, but walked through the screening with no symptoms. And by the time he got to his house, I think a day or two after, he started to feel unwell. And wisely enough, he went to a hospital, and there the doctors examined him, and I believe they found that malaria was negative, and they knew the travel history, and immediately referred him to for a test in Lagos at the Luth testing center, and there it was discovered that he was positive for coronavirus and immediately put under isolation. In fact, he had been put on isolation from the referral hospital in a special ambulance where the driver himself had been kitted. So there was pre-empty thinking on the side of the hospital and on the side of the drivers to transport him under those very specialized conditions to the infectious disease hospital in Lagos. The identity of patients is not generally released except with their own permission. So we're not going to tell you his name is XYZ. And also the name of the company he works with will not be released without their permission. That's not the normal practice. So he has immediately been put under very strict isolation. He received the treatment, and the information I have this very morning is that he's stable. The symptoms for all people will not be equally severe. And in fact, there are speculations that say that think that up to 80% of people who get the coronavirus infection may show only mild symptoms or none, and 20% will get very severe symptoms. But all this is still under investigation. As you know, this has been described as a novel coronavirus, which means it is new. Its behavior is not very clear, and there is a rapid trove of information coming out about it, which is just beginning to enlighten the public. Scientists are working very hard to know more about it. So it is not that there's a failure of screening. The screening went on very well, and it's not a failure of anything else. But as a matter of fact, we need to commend the hospital for thinking ahead and not wasting time and taking necessary measures, and commend Lagos State government for responding very appropriately. What follows this, to answer this second question, is contact tracing. We look at all those people who this man has been in touch with, backwards from the day he was admitted, and begin to go right back. The first point of call when anybody enters the country, and remember we have always said that we suspect that by air is the most likely putative form of entry into this country, which turns out to be correct. And the first line of defense there is the Port Health Services. The Port Health Services will be working with the airline to get the passenger manifest and find out where exactly this gentleman was, and also where he sat, and also those who sat around him, and set up the monitoring system for all the passengers and the crew members of that particular flight, in order to be able to get information to monitor their state of health within the next 14 days. And further questioning of the gentleman will also reveal where he was, where all he went. All we know now is that he came from Milan, where he was before. It doesn't seem that he ever was in China. It doesn't seem so. So he may have acquired it as a form of a community infection from his own country. So the question of quarantine, the World Health Organization advises everybody, all countries, that there is no need to put every single traveler into quarantine. There are some other countries who choose to do differently. But we follow the guidelines of the World Health Organization, which says that screen all persons who are entering your country, take their travel history. If they are coming from a country that has a high burden of coronavirus, invite them for further questioning, take the details, give them a phone number to call, you take their own phone number, and advise them in the interest of their own family and friends to stay in self-isolation for 14 days and report any symptoms immediately. Not only that, if you do not call, we call you and find out how you are, and if you have any suspicious symptoms, we send an ambulance to get you. The ambulances are there. Our focus is on the 4 cities with functional international airports: Lagos, Abuja, Port Harcourt, and Kano. Enugu Airport has been closed. I understand it will open very soon, but we're also preparing for that possibility. So discretionary, because of discretion, we do not reveal the personal details of the individuals involved. Now, the level of preparedness continues to improve of Nigeria every day. Training is going on. The people at the port health workers are receiving training. They are visited by Nigeria Center for Disease Control to continue to sharpen their skills and their preparedness and their knowledge. There is a lot of knowledge and skills transfer going on. You know that these kind of cases are not things you come across every day. So you need to continue brushing up the preparedness. We are constantly looking at where there are weaknesses and filling them. Even the forms that passengers fill when they arrive, we continue upgrading it. As long as immediately we discover that there is a gap somewhere, we upgrade it and repair the gaps that are in there. So everything is being done to improve preparedness and improve ability to respond rapidly. The final question was if the Commissioner of Lagos can declare an outbreak. No, an outbreak is something that's declared very formally, which we are doing now, declaring that it has entered our country and assuring the public that all measures are being taken to control and contain this outbreak. Because it happened in Lagos, the Lagos State Commissioner is the first that we were in touch with, and we have been talking to them all through last night till very late last night. As far as 2 or 3 a.m. we were in touch, and early this morning we have been in touch too, by text, by phone. I've also spoken with the governor of Lagos State, and I know the capabilities of Lagos. They are very well prepared. You know, they have a lot of experience from Ebola of 2014, so they are very well prepared, and the Nigeria Center for Disease Control will be sending people there today to go and see what the situation is like, and also help them with the interview of the patient and continue to monitor the situation. But the relief is that the patient is not showing very serious symptoms. And the other relief is that, as far as statistics are concerned, up to 97% of people who are known to have coronavirus do recover. Their life is saved. The terrible thing about it is that it is it's spread extremely easily, and people can get it without even knowing that. Yes. Okay, I think that's we have enough commodities. The federal government has released money, has released funds. We have been able to place order for all the committees we need. We are not short of those ones at all. Procurement is being made. And I believe that many of the companies who do manufacture all these things like masks and so on and gloves, they are speeding up their manufacturing process because orders are coming into them. So there is no concern about shortages of commodities at all. Even we didn't we have improved the reagents. We have increased the reagents we have for diagnosing this disease. We used to have very little at first, and we're worried about what if it gets finished. But we have received a lot. I also must say now that we have received a lot of cooperation, 2 visits already from His Excellency, the Ambassador of China, who has come visited us 2 times to reassure us of his commitment and to give us support in any way. They sent us a treatment protocol because they have successfully treated over 4,000 or 5,000 people in their country. They sent a treatment protocol which we have sent to our centers there to study and add to what they already know. I think we have covered those questions. Ambassador, yes.
Let's have some order.
Take over.
There's somebody. Please.
Please do not ask a question that's already been answered or asked.
Of course. Yeah, my question is, obviously with this arrival of coronavirus, Nigeria will be speaking with the partners in terms of raising funds, more funds. So I wanted to know how much is Nigeria looking to raise in this at this time. And you also mentioned that funds are being released. Can you please tell us how much that is?
Honourable Minister, I can project. I can project from here.
Okay. Go ahead.
Good morning, Honourable Minister. My name is Kayla and I work from Channels Television. I'm going to start with the National Economic Council meeting of yesterday. As of yesterday, you briefed the Council on the status of coronavirus in the country, and you said the 11 suspected cases turned out negative. My question is, when did this particular man get to the hospital to find out exactly what was wrong with him? When did he get to the hospital? Was it after the NEC meeting yesterday, or was it before the NEC meeting? Secondly, my question is, how did he get into the country? You said 4 to 5 days there's a 4 to 5 days window when the equipment will not be able to tell whether the person is sick or not. My question is, what are we doing about that situation? In those 4 to 5 days, is the patient contagious within those 4 to 5 days? And what are we doing? And if he is, what are we doing about that situation, sir?
Yes, thank you, Honorable Minister. Kule Adini from Kiss FM Abuja. Honorable Minister, you talked about trainings for personnel at the airport as to how to prevent the spread of this coronavirus. Now, the question is, following the entry of this national into the country, are we weighing the options of restricting international travels, both at the airports and at our borders? Because we also understand that our borders are very porous at the moment. So what steps are put in place? We noticed that in countries like Saudi Arabia, they've actually stopped pilgrimage, especially to prevent the spread of the coronavirus. What options are we weighing to actually ensure that we don't see more influence of people into the country who could be carriers of this virus?
The fourth question.
Good day, everyone. My name is Chimanwanko. I report for Arise News. I just want to ask 2 quick questions. First of all, are there any plans to limit, say, flights coming in from areas where there have been Ebola, where there have been corona outbreaks, where there have been that areas are prone to corona? And then second thing is, like, do we know the name of the airline that brought in this index patient that we say is in stable condition right now? Thank you so much.
Okay, so in the first place, the funding. The federal government has released every amount of money that the Nigeria Center for Disease Control and the Port Health Services requested. As I said just now, the first line of defense are the Port Health Services. Those are the first ones to see who is entering the country. The second line of defense is the NCDC, who now respond to any suspicious cases. The Port Health Services made a request for funds. I think it was about 70 or 74 million, and they have received it. The Nigeria Center for Disease Control, which has to buy the reagents for testing, buy all the supplies, the commodities, and so on, they made a request for 620 million, which has been released to them. It has been paid out to them. That's not to say that's all they need, because nobody knows the scope of this outbreak. You only prepare yourself and then follow up on, respond and play by ear as the situation develops. But our own emphasis here is that we'll do everything possible to limit and contain this outbreak so it doesn't go beyond what we are seeing now. Now, with regard to the Economic Council yesterday, yes, we were briefing the Economic Council as at what the situation was before we got there. This case that came in now was brought to my notice yesterday evening, after the NEC meeting yesterday evening. That's when it was brought to my notice. And at the time they brought to my notice, they were in fact still waiting for the laboratory result. They had already sent it in and said, we have a suspected case. We are waiting for the lab result. And immediately lab result came late in the night, where it was transmitted to me. And of course, I informed the presidency that this is what we have seen. And the formal letter will go to His Excellency to say that this is what has happened. And we also immediately wrote a press statement, which was released for Nigerians to know. All this is important to preempt any kind of speculation, and I urge all of you here not to listen to what social media is pushing around. Some people are having fun, trying to cause confusion and panic. So there is no discrepancy at all between the NEC and what we have seen here. Now, as for those who might be contagious, yes, as I said, this is a new virus. The behavior is not very well known. Science is trying to study it. Science wants to know, for example, because normally viruses are parasitic, they live inside the cell. And if they are not outside the cell, if they're outside the cell, how long do they survive on surface? That's not well known. There are some viruses that survive only a few hours and they perish. Others will stay longer. So the behavior of this virus is not so clear to science. A lot of research is going on, frantic research is going on. I have an electron microscope photograph of the virus. Where's the magazine I gave? I was holding it. Somebody took it away from me. Please bring it. I have an electron microscope photograph of it, which has been released. But more is being known. What is known is that once you are infected, it takes some days. That's the incubation period, we call it, for symptoms to show. We're just speculating it's about a few days, 3-4 days. Not that it's scientifically clear yet. But during that period, you might be contagious. How contagious you are is also not very clear, but it's clear that some people can walk through unnoticed and also do not feel ill. They feel very well. So that period, that situation bothers all countries, not only Nigeria. Many countries have seen coronavirus entry exactly for the same reason, that the person who brought it didn't have symptoms. So it's not peculiar to this country. It's something that is on everywhere. So how contagious they are is still being studied by science. Then the training. As you know, this is a new problem, the coronavirus. So the port health services will receive constant training, reminder training, update training. So it goes on continuously to adjust to whatever is known about the virus. Whatever science brings out, we impart it so that people are more prepared. As for restricting international travel, we follow the guidelines of the World Health Organization. They are not calling for us to stop international travel. Recklessly stopping international travel can backfire for you in many ways. So as long as you can control and contain an infection, you don't need to overreact. So we are working very closely with the World Health Organization. What I advise just now is that people should keep a social distance. If someone is coughing or has sneezing, let them stay at least 6 feet away. If you are coughing and you have a chronic cough, stay home. Don't go to crowded areas. Don't go and mix with people and start coughing around the place, because there is a risk of being able to send droplets into the air. That's the coronavirus in an electron microscope. An electron microscope isolated the coronavirus here. Okay? This side. That side.
Yes, sir.
Is the blue one there? That's the coronavirus isolated in an electron microscope. Okay. Okay. So the limitation of flight is not what we are doing, but you already know that several airlines are already restricting their own flights into high burden countries by themselves. So we are not the one banning any flights. We haven't seen the need, and we have only just one case, one index case. We want to contain that one and prevent any other one entering the country, and learn as much as we can from this particular case, so that we use the knowledge that we gain here to protect our own country and defend ourselves. We are also not profiling and stigmatizing. We are not focusing on particular nationalities and saying it must be this, it must be that. It's turned out to be a clean mistake, isn't it? So we're not focusing on any area. Of all we know is that we look at each person on his own merit, each traveler on his own merit, and we also look at the symptoms and on the conditions and their travel history. Those are the things that concern us. I think that's all as far as this particular situation is concerned. But we're also advising people to limit congregation, particularly in areas where there has been this particular virus has now been exposed. Congregation of people, unnecessary congregation. You know that some countries have prohibited sports, sport events or concerts, anywhere where people gather together in close proximity, where somebody might be coughing and sneezing around and releasing particles into the air. They are reducing those things. And like here now. But I don't think anybody who came here for the last 14 days from high burden country. Okay, so those are the things that we are restricting. Meanwhile, we are advising people to restrict congregation, unnecessary congregation, particularly in areas where this virus is known to have appeared. Okay, thank you. Those are the four.
Yes. Next four questions.
Next.
Hello, my name is Yoshima Abu. I report from the BBC. One of the success stories during Ebola was the fact that we engaged both religious and traditional leaders to educate the people. So you're talking about people shouldn't be in clusters and should avoid this. Is the ministry in any way engaging people in that class to ensure that they disseminate information, pass the right information, and not allow the people to just wallow in what is happening on social media?
Good morning, sir. My name is Ifeolu Abuja. I'm a photojournalist. A lot of Nigerians are skeptical that regardless that we have one confirmed victim, it's possible that we have more than one. Now, taking measures to quarantine people that are on the same aircraft with him, are you giving us any assurance that neither of them is also infected?
Two more.
Good morning, sir. I'm Chibuzo Okechukwu from China Central Television. One of the things that happened in China is, to prevent the spread or to at least curb it, shut down of businesses and the rest of them. Nigerians are very, very quick to panic and very, very skeptical, like my colleague said. Are we expecting the shutdown of businesses where people are going to be advised to start stocking up their houses, food, and the rest of them?
Thank you for this opportunity. So, we are where we are today. But the quick question will be, one thing I need to first respond to is not just the 4 airports. I know that Nigerians fly into Douala or to Yaoundé, coming from China, and they move their goods. These are smugglers. So I think we also need to target our borders, particularly the Cameroon border. That's one. Two, one of the last speakers spoke about working with traditional leaders, but I'll expand that to mean multi-sectorial approach. Because if we make it a health issue, we will struggle. But if we use a multi-sectoral approach, education, agri, just name it, then we'll be able to attack the last thing, sir, is is how do we mobilize people? How do we give the right information, which again ties into multi-sectoral approach? Because if we don't give the right information, then the wrong information will thrive.
Thank you. When we started this press conference, the first thing I said is that we are trying to be ahead of wrong information. That's why we are giving this briefing, and that's why for the past 3 or 4 weeks we have been giving briefing every Friday. The last one was done by the Honourable Minister of State. So exactly the question you are asking has been answered, in that we are trying to be ahead of that and to inform the people, give you the correct information as it is. As for religious leaders, yes, we do believe that religious leaders, traditional leaders, community gatekeepers, they are all listening to what we are saying. And they will definitely be advising their people to be echoing and reinforcing this information, because as a leader, definitely you don't want your people to get sick. And if you hear of this kind of advisory, I'm sure they all call their congregation and advise them to follow the guidelines that are being given. So that is already taken as a given, which I believe that all leaders and political leaders too will inform and advise their communities in that way. Now, as for the question about the flight, we are working with the airline. We are developing, we are going to get a manifest and then do a contact tracing and find all the people who are there. They usually you get their numbers and their addresses and monitor them. We're not going to assume that all of them are sick or will fall sick, but and advise anyone who has any symptoms to report and be monitored and be checked. So we have enough reagents to do the checking now. There are 4 laboratories in Nigeria that can test for this particular virus. 4 are able to test for it. We also have a system for sample transport. So a sample can be taken from somewhere and transported to a testing center within a few hours. So that is part of the network that we have prepared. Now, as for the lockdown of the city, there is no need for that at the moment. We have just seen this case yesterday and observing very closely as we kept under full isolation and is being given necessary treatment, and we are doing a contact tracing, watching to see who or how many people may have been affected, which we do not know yet. So we do not want to overreact. We know at this stage a little bit more about the coronavirus than China knew at the day it broke out, because that's the first day it came out in China. They themselves were in the dark. They didn't quite know what it was. But in the meantime, we have gathered enough information to be able to respond in a more structured way. So in China, of course, they have to do a lot of things very drastically in order to save the situation. We are going to see what measures we are taking. We are a secondary infected country. If you look at other countries in Europe, in Belgium, for example, I've read they had 1 or 2 index cases, and since then they have not seen any. So it doesn't mean that you will see many after this one. So Belgium has not seen any since then, and they are watching to see what happens without taking any drastic measures. As for smugglers, well, we have already done a risk assessment. And our risk assessment is that we know that this outbreak started in China. We know that it has spread to other countries, particularly in Europe and Middle East. We know that. So we know that if it's going to enter this country, it has to come from any one of these. It's not somebody who is trekking into Nigeria, because the person has to come in and he has to fly in, most likely. Now, if he's to come by boat, he can come by ship, but the ship journey usually takes about 2 weeks or 3 weeks. And the incubation period of 2 weeks, he will fall sick and will be noticed on the ship. So the possibility of anybody sneaking in by ship is very remote. Even those who fly into Douala, and even if they are smugglers, before they gather their goods and start preparing for the journey, 14 days will be over, they will fall sick because the incubation will show. So the process, and before they cross the border, the process for them is longer. So the likelihood is less. We're not removing the likelihood or the possibility. But if you are preparing for a challenge, you must know where the challenge is going to come from and focus your energy there and not focus it where it is less likely. So the land crossing, yes, is possible, but not so likely now. And the entry of this case now, and also the entry of the man who brought Ebola, shows quite clearly that such things usually will go travel. As you know, this case also reached the United States of America, the coronavirus. It had to have gone by air. It couldn't have gone by ship. So we are looking at that point of entry as the most critical and not ignoring the others because they are less likely because of the longer journey and the fact that the symptoms will break out during that long journey and the person will be incapacitated and will not travel further. But even if they come in, they will be noticed and found to be sick. So that's why we are prioritizing like that. And that should take care of the smugglers. So I think that's all. We have answered most of all those questions.
Thank you very much.
I'm not going to say anything. So maybe you need to just to say that.
I don't even know what he's here for. I didn't know what he came for.
Okay, he just came.
Yeah.
Okay, it's okay.
Okay, thank you, everybody. Before we go, I would like to add a few words of advice. And let me say first of all that last Saturday I was in Addis Ababa at a conference of African Ministers of Health, where we discussed our old African strategy for facing this coronavirus spreading into Africa. Until today, only 2 other African countries had the coronavirus, Egypt, Algeria, and today Nigeria. So we had this meeting to try and work out a common strategy, and secondly, to find a way of supporting each other if there is any problem, because not all countries in Africa will have the capacity even to do the diagnosis, and one other country will have to do it for them. So we are all prepared to be each other's keeper. And that meeting went very well. So Africa has its own strategy. There is a system that was worked out, and we are working very closely with the World Health Organization in that respect. So before we close, I would like to give the microphone to the representative of the World Health Organization to give us an update and a general briefing as the last word of this press conference. Dr. Peter, please.
Thank you, Your Excellency, Honorable Minister of Health, Honorable Minister of State for Health, Permanent Secretary, my colleagues who are the directors from the Federal Ministry of Health and NCDC. Let me thank you first for this important briefing, which touched all aspects of the response in a more scientific aspect. Indeed, globally, the sounding from WHO is very clear. We don't know how this outbreak is going to go. While things should be stabilizing in China gradually, many countries are getting cases that have no link to China. And it means, as the Honorable Minister said, we are dealing with secondary cases, which sometimes become very difficult in terms of catching them at the airports, but they manifest when they are already in the country. Right from the word go, Honorable Minister, I would like to thank the government through you for having first given that leadership. We had the technical meetings through NCDC, which brought all areas of the government, departments and ministries, but also all partners. And this answers the question of a multi-sectoral approach. Nigeria's CDC is one of the best CDC in Africa, and it is led by renowned Dr. Chikwe, who is one of the experts that WHO mobilized to visit China and advise WHO. With that capacity, you should know what direction the country is taking. We are very proud of that. You also had this meeting getting all the other stakeholders together, which you shared, a testimony that you are taking as a government seriously. Well, with all the sounding, we know this could happen in any country in Africa. But I think what is important is how do we control it quickly, which you have alluded very well. The steps that are being laid down in terms of getting all those who were exposed during the travel and the visit of this index case in Nigeria have been taken seriously. All the other partners are going to work with you. WHO has promised, before coming here, I had the word with the regional director to clearly say what are the urgent and immediate actions that the government will take and what support is required. This demonstrates the solidarity that is required in this kind of situation. We must be guided by facts, not rumors, and actually it's time for action. When we have situations like this, let's act together, the whole of government acting together. And I'm proud that the incident management system, which was a lesson learned from the Ebola, has been elevated to level 3 because of this situation. WHO definitely will work with you, will support Nigeria in all this process, and also work with all the other partners in ensuring that we have give people the right message. We ensure that there's capacity to really address the situation as quickly as possible, and that everyone will receive facts, not rumors. And I'm happy that the media is here. Always check facts with the Minister of Health so that you get the real information. The social media is to help us in terms of networking, reaching everyone, but sometimes we don't have the same discipline in using it. The issue with the public health threats like this, we need to get the facts and get people the right information. People want to know what it is and how can they prevent themselves and what the government is doing. So these are the actions that you have already alluded to. So really, thank you very much. We'll be with you to support you in this process. Thank you.